people going to be doing? This is what we are going to be doing. One, many people are not aware that social practices, but that predisposes to a condition which leads to cancer. So we're going to be focusing on that and guide our oral professionals to, as to what they need to tell the patients and what they need to look out for. The third thing is what I emphasized on. A lot of oral diseases happen in the oral cavity. Oral diseases reflect what is happening in the body. I'm sure you as press are aware that, heart disease, diabetes, even pregnancy, certain aspects of pregnancy are influenced by oral health, by which I mean they affect oral health, and bad oral hygiene can make your heart disease worse, can make your gums worse, and prevent the doctor from controlling the sugar levels in patient very efficiently, and things like that. Then you have forensics. Now this is the thing which is gaining a lot of importance, sadly so, because you must have heard of the mass disasters, the airplane crashes, bombings and things which we are all not very proud of. But dentists can contribute to identifying people, and there are a lot of features. And in fact, from this year onwards, the forensic odontology is going to be a part of the dental curriculum for dental students. And so we are going to be focusing on that. We have some leading experts come in and talk to us about that. And last but not the least, there are a lot of students who say that, I want to go into research, and research is really becoming popular. And as our former president Abdul Kalam used to say, and a lot of youngsters have taken up research. So we have people from ICMR, the Indian Council of Medical Research, the National NABL, which accredits various labs, and they are going to come and talk to the budding pathologists and tell them what the options in research are, particularly on stem cells. Because as you are aware, the tooth is a very good source of stem cells. Now the stem cells are taken from bone marrow, fat, but the cells within the tooth, when they extract the tooth, you can remove that and generate a lot of cells, heart cells, bone cells, so many things which are very exciting. And we as dental professionals can help, the medical professionals and the researchers in the stem cells. All this is fine. All this is going to translate into good practice for dentists, and patients are going to benefit. But what about the public? So we decided that we are going to create an awareness program, and I'll ask Dr. Umar to briefly describe to you about how we have recruited schools to disseminate the knowledge of oral health and how important it is.
Good evening to one and all who are assembled here. To brief you on our role to the public, I think the public is made up of today's children. So I think the organizing committee decided to address these children, and I thought the best option would be to meet them in their respective schools. So under the leadership of Dr. Ranganathan, we have launched this program. We are trying to rope in as many schools as possible. Right now we have lined up about 20 schools. They are from different spectrum, both government aided schools, matriculation syllabus, CBSE syllabus, and then our staff are calibered and they are trained to make a presentation to these students focusing on the importance of oral hygiene and the habits, because we catch these children young, and then I'm sure the purpose of a conference of the ill effects of the habits can definitely be targeted right from this age group. So to encourage these children to participate in this program, we've announced an essay competition where we'll be having 3 entries coming from each school. If a particular child is not comfortable with English, we have given them an option of doing it in the vernacular language, and they can submit 3 entries once when the teachers choose the best, and then they'll email it to us. So the different schools will be sending, either by whatever form of communication they want, the essays will land up to us, and then we will have a jury set in, and we will select the best essay. The topic given to them is oral health for overall health. So we want to see how much they have a global understanding of the relationship between the dental health, the oral health, and the general health. So this is one of the important aspects of our conference, which we are focusing upon to train these young minds.
And to
Yes, very good. We are having, of course, pathologists who are doing postgraduate from all colleges. In addition, we are inviting the interns. You know how the dental program is, right? After 4 years, you have an internship. So we're inviting selected students, interns from all the colleges in the city. So they will come and see and decide that they can take up oral pathology as a part of their career. So we are motivating them with that too. Yes, we're doing that. And we are going to have poster sessions where the individuals, the international and national speakers will go around and guide them and tell them, you know, what's good about their poster and how they can improve it. Or they can pick up points from our research too.
Any initiative taken by the association with the government to restrict these kinds of
Oh yeah, that's any initiative taken by the association with respect to inhibiting this. Yes, we have done a lot of, I'm sure, and from the press you're aware that, you know, the anti